Hello everyone. This is Khanak Institute of Medical Science, Patna. Today we know about ECG. An electrocardiogram, ECG or EKG, is a medical test that records the electrical activity of the heart over a period of time. It is a fundamental tool used to diagnose various heart conditions and assess the heart's rhythm and function. ECG interpretation is a crucial skill for medical students and healthcare professionals, as it provides valuable information about a patient's cardiac health. How to perform an ECG? Performing an ECG involves attaching electrodes to specific locations on the patient's body. These electrodes detect the electrical signals generated by the heart and transmit them to the ECG machine, which then produces a graphical representation of the heart's electrical activity. The standard 12-lead ECG setup involves placing electrodes as follows. 1. Limbs. Right arm, Ra, electrode, on the right arm. Left arm, La, electrode, on the left arm. Right leg, Rl, electrode, on the right leg. Left leg, Al, electrode, on the left leg. 2. Chest, precordial, leads. V1, fourth intercostal space, right sternal border. V2, fourth intercostal space, left sternal border. V3, midway between V2 and V4. V4, fifth intercostal space, midclavicular line. V5, horizontal to V4 on the anterior axillary line. V6, horizontal to V5 on the midaxillary line. Interpreting an ECG. Interpreting an ECG involves analyzing various components of the waveform, including the P wave, QRS complex, T wave, and U wave, if present. Here's a basic guide for medical students. 1. P wave represents atrial depolarization, contraction. Duration should be as less than or equal to 0.12 seconds, 3 small boxes. Should be upright in most leads. 2. PR interval. Duration from the beginning of the P wave to the beginning of the QRS complex. Normal range, 0.12 to 0.20 seconds, 3-5 small boxes. 3. QRS complex. Represents ventricular depolarization, contraction. Duration should be as less than or equal to 0.12 seconds, 3 small boxes. Normally upright in leads I, 2, and V4 to V6. 4. Saint segment. Represents the interval between ventricular depolarization and repolarization. Normally isoelectric, at the baseline. Elevation or depression can indicate myocardial ischemia or injury. 5. T wave. Represents ventricular repolarization. Usually upright in most leads. Inverted T waves can indicate various cardiac conditions. 6. QT interval. Duration from the beginning of the QRS complex to the end of the T wave. Corrected for heart rate using formulas, QTC. Prolonged QTC can lead to arrhythmias like tossades the points. 7. U wave. Small waveform after the T wave, not always present. Thought to represent late ventricular repolarization. Prominent U waves can indicate electrolyte imbalances. Remember that ECG interpretation becomes more complex when diagnosing specific conditions, and it requires a comprehensive understanding of the heart's electrical activity and its correlation with physiological and clinical context. It's advisable to study ECGs under the guidance of experienced clinicians and to refer to reputable ECG interpretation resources to build a solid foundation in this skill. This is Khanak Institute of Medical Science, an institution of paramedical course like radiology, medical lab technology, operation theatre technology, physiotherapy etc. Address: Ashok Market, Main Road, New Jaganpur, Patna 80027. Website: www.kimspatna.com. Mobile number 8271021507.